What's driving people to shop or change Medigap plans in 2025? We're covering what you need to know if you're considering a change. Welcome back to Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today, I am sipping on a whiskey cola twist. Cheers, let's dive in. And before I begin, I want to thank our friends over at Didnt Research because all of the data that I'm going to use today is from a 2025 Didnt Research study. So before we start to take a look, this is data from last fall, which would be the 2025 AEP period, so fall of 2024. And when it comes to the Medigap or Medicare Supplement data, 40% of people that were on a Medicare Supplement or Medigap plan shopped for a new plan but did not end up switching, whereas 9% did end up switching. So if you think about it, that's nearly half of all people that are on these plans that either shopped or did change a plan. So what drove people to switch? What's really going on here? Frankly, what we see a lot is people that want to maintain or reduce overall healthcare costs. So about 60% of all of the switchers that I mentioned earlier said this was a priority. Lowering their monthly premium cost, 56% of switchers wanted to lower their premiums. About half had double-digit rate increases in 24. And I'll be frank, a lot of what we're seeing in 25 is even more than what we saw in 24. Additionally, there's some poor customer service complaints that we saw. Those who switched, they were just frustrated with a lot of the things going on. So who are more likely to switch? Young seniors, those that maybe when they were working, they were putting off a knee or a hip replacement, and when they originally went on Medicare, they decided, I'm going to go on a Medicare Supplement because of all that it covers. And then after a while, they're just not using the coverage quite as much. Middle to lower income individuals who just couldn't keep up with the premium changes. Those who took more prescriptions with some of the Part D drug plan changes last year. And those that have been on the plan for a shorter period of time. And essentially, what were they switching to? Most switched from one Medigap or Medicare Supplement plan to another Medicare Supplement plan. And about a quarter, 25%, went from a Medicare Supplement to a Medicare Advantage plan. So then on the flip side, why others didn't switch? Most, frankly, were satisfied or really liked their current plan that they were on. The thing about the supplements are you're paying more for them, but you're typically seeing little to no out-of-pocket expenses throughout the year after a small deductible. The loyalty and perceived stability of the Medicare Supplement or Medigap plans. Concerns about medical underwriting. After you're on a Medicare Supplement for a period of time, to switch to another one or to an Advantage plan and back, you're eventually going to run into some medical underwriting questions. So unless they qualified for guaranteed issue, a lot of them were concerned about this. And then, frankly, just low awareness of how and when they could switch plans. So kind of on that note, when can you switch Medigap plans? You could switch from one Medigap to another Medigap at any point. Some insurance companies do require you to go through medical underwriting. It depends on the situation in which you're switching. But I would encourage you, if you want to go from one plan to another, check that out. Call your insurance company. There's no set enrollment period. It's not like with Medicare Advantage or Part D drug plans where you have AEP in the fall to make a change. But however, after your initial 6-month Medigap open enrollment period, kind of how I did mention earlier, you might have to go through medical underwriting to check out other options. There's a few ways around this, but it's just worth mentioning that this is something that after a certain period of time, you should be prepared for. So if you're worried about the cost of your Medigap or Part D drug plan, just give us a call. Our licensed advisors can renew your current coverage and check out if you qualify for a lower cost Medigap plan. We'll also look at your prescriptions and see if maybe there's a different Part D prescription drug plan that could save you money. And if you want to compare a Medigap to a Medicare Advantage plan, we can help with that too. I would recommend that if you've never checked out that option, it's always worth just being aware of sort of the difference between the two and how they work separately. And it's just smart to review your coverage every year, and we're here to make that easy. If you have questions, we're here all year long. Just give us a call.